Well, we all want to look as good as we possibly can, and I think it's safe to say that for most of us, we have things about our appearance that we don't necessarily like. Scientists have shown that we all think of ourselves as being younger than we actually are. However, one day that reflection that we see in the mirror doesn't connect with the image that we have in our mind. And diet and exercise can help us feel healthier, but we can't control the way our skin and our face ages. When I look at someone's face, I see one of three different types of problems. The first type of problem I refer to as structural. Either the nose is too big, maybe it just doesn't fit with the face, the chin is recessed, or the cheeks are flat. For the most part, these problems are addressed with surgery. In the case of the nose, it's a rhinoplasty or nose job procedure. I put implants in the chin and the cheeks to augment those areas. And in recent years, we've developed techniques to be able to use fat more effectively to augment the face. The second problem that arises with the skin has to do with looseness. Individuals with heavy or thick skin tend to see more loss of elasticity and begin to see some sagging around their eyes, along the jawline or jowl area, and down into the neck. And again, most of the time these problems are best handled with surgical alternatives. Although in recent years, some devices have been developed to non-surgically tighten the skin. My experience tells me that the results are subtle and not long-lasting, and I typically reserve these options for younger patients or patients who are just starting to notice some looseness of their skin. The third problem that arises is what I refer to as texture change. Those of us with thin skin, sun-damaged skin, tend to see more wrinkles, irregular pigmentation, and roughness of our skin. And these problems typically respond to either skincare products, light treatment, or a whole host of what I refer to as resurfacing options, either microdermabrasion, chemical peels, plasma resurfacing, and lasers. The option which is right for you really depends on you asking yourself one of four questions. How bad are the problems? How much improvement do you want to see? How long do you want that improvement to last? And lastly, and most importantly to people, is how much downtime can you afford? Because as you become more aggressive with these treatment options, you're going to experience some redness and some downtime. Our job at the Sullivan Center, or I should say my job, is to help you clearly understand all of the available options available to you and to empower you to make the right choices for yourself.